Imagine undergoing a hair transplant after a lot of deliberation, then waiting for 1 year to get your desired results, taking all the medicines, following all the instructions which your doctor or your clinic gave. But in the end, at around 12 months or 15 months, finding out that your growth is poor, your hairline looks very unnatural. People have started noticing this. They look at your hairline and not at your face, sometimes giving you awkward remarks like, what has happened to your hair? It's looking so unnatural. Or even more horrible, to get bad scars out of the hair transplant. The angles are weird. They are coming out at, say, 90 degrees out of your temples, and people wondering, your friends, your family also pressurizing you or saying negative things about your hair transplant, and then thinking, why did I do this mistake of a hair transplant? We understand your problem because we also do get a lot of patients like this who have undergone a hair transplant somewhere but are suffering from its poor or bad outcomes. The primary thing here being not being told that sometimes, rarely, even in the best of the clinics, the growth can be poor, but having other complications like scarring or bad angles is something which definitely shows that the poor planning was there in your hair transplant. In this video, we are going to discuss these ways in which we are going to improve upon your bad hair transplants. By the way, if you are looking out for such more content, please do subscribe to our channel. Now let us discuss what common problems are there when you consider that the hair transplant is failed. The first and the most common which we see is a bad hairline. And what does it mean? A bad hairline means that either the hairline is very straight, because naturally the hairline is irregularly irregular. But if you make your hairline too straight, it looks very unnatural. It is too low. There are multi-graft hairs in your hairline, like 3 or 4 hair grafts are seen in the front, which is again unnatural. Or there is a railroading, which means 2 rows of transplanted hairs is running parallel. So this is one of the common bad hair transplant which we see. I am Dr. Satya Saraswat, American board certified gold medalist plastic and cosmetic surgeon, doing hair transplant and treating patients of hair loss since 2006. That is like 19 years. And we have trained more than 90 doctors in the field of hair transplant. Second one is a bad FUT scar. FUT scar sometimes can be very wide, very thick, and it can look horrible in many patients. And this happens when either the skill set of the clinic or the doctor is not that good, or if they are trying to take out a very, very wide strip, and this leads to this bad and horrible FUT scar. If FUT is done in a perfect way, the scar should be barely visible even in a clean shaved scalp. If you want to see such interesting topics and videos made out of that, please mention in the comment section below a topic on which you would like us to make a video for you. Third most common problem is that clinic told you 6,000, 8,000, 10,000 grafts. We know a patient, he said that a particular clinic somewhere did 20,000 grafts for him. And we could see his chest, beard, entire scalp was totally thinned out and it was looking very bad. And here also the growth was very, very suboptimal. So this is a depleted donor site, the third kind of botched up kind of hair transplant which we see in our practice. And the last one which we are going to discuss here is when the angles and the direction of the transplanted hairs is bad. Normally, when we make the slits, we make it sure that the angle and the direction should be as natural as possible for that area. But if this has not been observed or taken care by the doctor or the clinic who has done your hair transplant, then it is obviously going to give you a very, very poor, horrible scars. Last but not the least is the poor growth. So the poor growth sometimes can be due to some skin problems, sometimes even due to stress. And this is, a doctor will always discuss with their patient that this is a rare possibility. Maybe around 2% or 3% of the cases can have this problem, and this has to be accepted, and then only you should take a decision about getting a hair transplant done. So this is the common kind of problem which we see. But you have to know that getting a bad hair transplant is not the end of the road or the end of the world. There's always something we can do about a bad hair transplant. Now, before actually discussing what we do in such cases, let me tell you there is a tool, an artificial intelligence based tool about which we are going to discuss in this video, to know how you can know what your kind of results you will have after getting your botched up hair transplant or a bad hair transplant repaired. So keep watching this video till the end. Now, this tool which we are talking is known as PeekAI. It's a peek into your future results or a probable hair transplant results after putting your pictures in our Saraswat Hospital app, the link for which is given in the description here, and you can download it, put your basic information and get the desired results which you want to achieve out of this. If you are suffering from a bad hair transplant and do want our help for your particular case, please do call us at the numbers mentioned here. So let us discuss a specific step or a solution which we offer to our patients suffering from these bad hair transplant. If you got your hairline unnatural, sometimes we have to extract these grafts, we have to take out these grafts, and this also holds same true for the bad angled or bad direction grafts. In both of these cases, sometimes we have to take out the grafts in such a way that your hairline start looking more natural. This may need more than one sitting at times. A bad FUT scar or a depleted donor site, what are the things which we can do? For FUT scar, there are two options. First is scalp micropigmentation, and in this video given in the link above, you can see how a patient's bad FUT scar changed to an almost normal scalp by doing a scalp micropigmentation. This can also be done in those patients in whom lot of grafts have been taken out and there is a lot of thinning and scalp visibility after the transplant or by FUE technique. So for both these things, we do SMP. And last, if you have got poor density, sometimes before actually planning a second surgery for a patient who has come out with a poor density, we look at the clinic or the doctor who has done. If it's a good clinic, then first step we do is we take out a small biopsy and wait for the results rather than jumping for a new hair transplant. Wait for the results. If everything is okay, then we do a redo surgery, and then we find out doing trichoscopy, and there are a lot of tools by which we find out how many grafts can be taken, how much area we can cover. So that is the way in which we try to correct. Every case has a customized plan. It's not the same thing which goes on for every patient. If you find this video useful, we request you to share this video with your friends or colleagues or anybody you know who has got a transplant but has not got the desired results. To know how to choose the best doctor or a clinic for your hair transplant, we request you to watch the video on the link given in the left side, and to see a detailed podcast on this topic on how we deal with our bad hair transplant cases, please watch the video given in the right side on the link here.